All right, this will be the bones of the skull. There's a lot of bones in the skull with a lot of features, so we're just going to highlight the ones that we need to know for the class. So with this anterior view, first one we're going to look at is the frontal bone. And the frontal bone makes up the frontal part of the skull. Learning the names of the bones will help you to learn the names of the muscles that go over the bones, but also the lobes of the brain when you get to that in A&P2. So here's the frontal bone, and frontal bone is the one feature we need to look at is the supraorbital foramen. So that's the one thing you're going to have to identify in the frontal bone. So you should be able to identify the frontal bone and the supraorbital foramen. So it's a pathway for nerves and blood vessels to exit and enter, I should say, the skull. While we're right here, we can look at the mandible. The mandible is the only movable bone in the skull. And for the mandible, you should understand, or you should be able to identify, change my pen color. Mandible, you should be able to identify the mental foramen. And we'll look at some of the other parts of the mandible in a few minutes. For the maxilla, maxilla is the upper jaw bone. For the maxilla, you should be able to identify the infraorbital foramen. Okay, so remember, foramen are a pathway for holes in the bone through which blood vessels and nerves can pass. Okay, another bone to be able to identify are these cheekbones, and these cheekbones are called zygomatic bones. So here are the zygomatic bones. The lateral view. From this one, we're going to be able to see the temporal bone. Let's try this one. And the temporal bone, we can see the external auditory meatus, or external acoustic meatus is the same thing, and this is where sound waves enter your ear. Let's see, mastoid process. Mastoid process is this place where you have a lot of your chewing muscles attached to the bone. Styloid process, also a place where we have muscle attachment. The zygomatic process of the temporal bone is the piece of the temporal bone that articulates with the zygomatic bone. And there's also the temporal process of the zygomatic bone. So these two make the connection there. Okay, and for everything else on this one, we have to look at the inferior view. Here's a good view so we can see these different joints in the skull, and the joints are called sutures. So the coronal suture here, you have to know that. Make sure you know the coronal suture separates connects the frontal bone and the parietal bones. The lambdoidal suture connects the occipital bone and the parietal bones. And then the squamosal suture, or squamous suture, squamosal, connects the temporal bone and the parietal bones. Okay, on the maxilla, we can also see the coronoid process of the maxilla. Okay, this inferior view lets us see a lot of the features we need for the for these bones. So the occipital bone makes up the back of the skull and a lot of the base of the skull. So the occipital bone, oh, you can see this lambdoidal suture continues down here. The occipital bone has a foramen magnum. So foramen magnum makes you think of large hole. And this is where your spinal cord passes through from the vertebra into the skull. And you also, from this, you have to know the jugular foramen and the carotid canals, both places where blood vessels pass through. Let's see. There's nothing new on here for this one, so we've already talked about the mastoid process and the styloid processes. Okay. This is a view, superior view, if we had cut off the top of the skull. So remove the parietal bones and most of the frontal bone. And from this, we can see the foramen magnum from the inside. There's the occipital bone, jugular foramen here. Let's see. Oh, and then this bone is called the sphenoid bone. The sphenoid bone kind of looks like a bat, apparently, but it has a special structure in there, a special fossa called the sella turcica. And the sella turcica is where the pituitary gland lies. So in the sphenoid bone, this is where the pituitary gland would lie. Okay. This is part of the ethmoid bone, and what we're really concerned with this is the middle nasal concha and the superior nasal concha, and the perpendicular plate. Perpendicular plate helps to separate your nasal cavities. So your left nasal cavity from your right nasal cavity. This is a mid-sagittal section of the skull, just showing you how these different things are look in a mid-sagittal plane. Okay, this is specifically the mandible, pointing out the rest of the structures we need to know. So with the mandible, you have the mandibular condyle and the coronoid process. The mandibular condyle makes up most of the temporal mandibular joint for the mandible. There's the mental foramen, which we've already pointed out. The ramus is this ridge of bone that's laterally oriented. Okay. And this is the infantile skull. These infantile skulls have these fibrous membranes that allow the baby, when it's being born, to pass through the birth canal. So it allows the bones to have some flexibility and almost slide over each other. And these this connective tissues are called fontanelles. The anterior fontanelles, one of the last ones to fully ossify or fully become bone. And it happens at around 18 months. So at 18 months, the correct answer is at 18 months, the anterior fontanelle becomes fully ossified. Okay, and there's just another view of that. This is that soft spot that you always tell kids not to touch, but then they always touch when you're not looking.